and we are live with a very special guest. We have Lorena here, and extremely excited to have her on, and also really excited about the fact that I don't have a virtual background today. Uh,
Thank you for having me.
you're welcome. You're welcome. Lorena, tell us and our audience what you do and what you've been up to so far.
Yeah, so I have a background in research and I've done some lab work. I'm currently launching into working as a registered nurse in the Cardiothoracic intensive care unit. And my goal is I'm a project manager also. I want to kind of find a way to forge new ground in the areas of healthcare using my project management, my research background, but then also now I have the clinical presence to kind of find ways to get better practices into the clinical setting faster. Because it takes 13 to 20 years once new research is okay, yeah, this works, it's legit, this changes lives, this saves lives, but it takes 13 to 20 years to actually get it into clinical practice. So that's kind of the goal of like the outside, but my focus is on dysbiosis. That's the big buzz right now.
Okay. So again, you've thrown out some words that I am not 100% familiar with.
Okay.
So can you tell me more about that?
So dysbiosis. So bad, biosis is like the little microbes that live in our body. So if you can believe it, there's actually more bacteria living in your gut than there are cells to your body. So if you think of what makes up you as a human, you think, oh, it's me, my face, my hands, my body. But in fact, the microbes that live in your gut outnumber the cells that make us look like who we are. And there's just a huge buzz right now about do you have a good balanced colony? So just like you have a good community out here of say doctors, lawyers, artists, your body and your gut has kind of a similar community. So if you have say too many lawyers in the world, that would not be a good thing, right? We want to have a balance.
Although if there's any lawyer
I
watching,
love lawyers.
I
My
only
lawyer's great. If he sees this, you know I love you. But it's been a big buzz because I think there's a focus on health. There's a focus on diet. There's a focus on our anxiety. What did COVID teach us? That we kind of all have a new heightened level of anxiety about the entire world. But guess what? What happens in our brain is directly connected to our gut. And there's a little bit later, I'll get into more specifically how the gut affects the brain because there's new research that actually shows exactly what that pathway does. And actually, when you change the little people that live, the little bacteria that live in your gut, how it directly affects your brain. So anyway, so one thing I care about passionately working in the intensive care unit is what do we do in the hospital? Everyone gets broad spectrum antibiotics. And what that does is you basically wipe out. You have more microbiota than cells, and we kill all of them so you don't get an infection. But then that just like killed off your whole community. Who's left? Probably a couple bad guys that maybe aren't the best, but they're good at living. And then they take over, and that's where you get super infections and inflammation and all of the above. So what I hope to do is there's plenty of research about how to restore the flora, but how do we bring it into the hospital setting? Like you go to your naturopath, you go to your homeopath, your functional medicine doctor, they're great at talking about diet, probiotics, all these different treatments, but it's not often in the clinical setting to go, hey, guess what? We wiped out your whole community. Now here's how we can help you restore it. So that's kind of the biota side of
that
things.
no, that's good. And what got you into this field in the first place? Like what was the inspiration for you to get interested about the bacteria living in our gut?
It's an interesting road actually because it's not what you would expect. So I was studying psychology and I was in my rotations in the inpatient behavioral health and in learning about the pharmacology associated with different psychiatric conditions, it was alarming to me to learn that most of the things that modulate are neurotransmitters. So neurotransmitters are like little chemicals in your body that say, you do this, you do that, you stop doing this. They're like little chemical text messages within your body, right? so what we do is, okay, you have a psychiatric condition. Let's give you different chemical messengers, or more or less of them. But the problem is most of these actually have, like, so for example, you have suicidal thoughts. I'm going to give you a medicine. It's going to change your neurotransmitters. And what's the biggest side effect? Suicide. And so I was like, this is not okay. So this kind of is my back road into microbiome. So I was looking at alternative ways to deal with psychiatric conditions. There has to be a better way to do it than give people, a more propensity to be suicidal in order to combat suicidal ideation. So then I was researching it, and of course, there's a huge thing about the gut connected to your brain, like I talked about before. And so when I was looking at it, one of these new treatments that is actually being done to combat psychiatric conditions is this thing, this, bear with me, it's a little unique. It's called a fecal microbiota transplant. So what is that, you think? Okay, so I talked about there's a whole bunch of different bacteria that live in your gut. So what you do is you take someone who has no stress, no anxiety, they have to exercise, they have to eat a certain way. You take their microbiota, which is basically purified and cleansed fecal matter, and then you transplant it into the individual who has the psychiatric condition or extreme anxiety. And what they're finding is it's like a patient who has going through alcohol withdrawals, extremely anxious. You can have seizures. I mean, it just makes you feel horrible. If you give them a transplant of clean microbiota into their digestive system, zero anxiety during withdrawals. And I was like, holy moly, this is
Wow.
humongous. That just the implications of, huh?
What?
Go ahead.
That's insane. What happens to all the psychologists, therapists, and everybody
I know,
else?
well, I mean, to me, it's one, it's not something everyone, because I think that fecal matter has a connotation. People are like, do I want to have a transplant of fecal matter? But I feel like it's a tool that's underutilized. And I feel like, it's something that, could be monetized. For example, if you are a donor, you get thousands, over $10,000 per donation. So it's something that is new and up. Yeah,
Oh,
right. But you have to fit.
well, I would love to sign up for.
The easiest money, but you have to fit, certain criteria. And that number might have changed since I got my research on it. But so I was sort of back into where I wanted to land in the ICU setting. So going, okay, look at what happens when you change your microbiota. And then I looked at the psychiatric implications, which is just astounding. But it's still new. So most people, they do it mainly for uh, like I said, alcohol withdrawals. And in the hospital, they do a fecal microbiota transplant if you have a really bad super infection called Clostridium difficile. Don't worry about that. But if you get a really bad imbalance that causes like extreme diarrhea, they'll give you this transplant, but they don't do it for anything else. And then I was like, what? This is like so amazing. And I'm like, why does it affect it so much? Then I'm the research nerd upon nerds, so I'm digging in like, why does it cause this? And then I learned you have like the good guys and the bad guys, right? So the good guys is like your lactobacillus. You always hear every probiotic you get lactobacillus, right? That guy, so
Yes.
your whole digestive system is a big tube. Lactobacillus makes the tube very solid, so nothing gets through it. It's doing its job, it's happy, it's releasing all the happy things it's supposed to release. If you have different bacteria, it actually causes increased permeability. So it makes your whole tube kind of go like this, which means instead of going through the blood to get nutrients, you actually have like fecal matter leaking into your body. Let's just guess what that does to
Oh,
inflammation, chronic inflammation,
yeah. That's
disease. Yeah.
that's not gonna make things good at all.
Yeah. So then I was like, oh my gosh, the implication. Then I started getting like deeper into it, going, wait, in an ICU setting, we kill everyone's microbiota. And then they come back with chronic inflammation, depression, anxiety. So you come in for a gunshot wound or a car accident, and then you come back for an autoimmune disease or inflammation or just joint pain. And is that something we caused? Yeah, it could very well be, because when you have the different biota that is causing that permeability, that causes systemic inflammation. And like I said, if it decreases anxiety in people with psychiatric conditions, then someone who's gone through trauma and they now don't have that good biota, they actually will have anxiety. So I didn't come in with anxiety, but now I'm going home with chronic anxiety. So I was like, holy moly, this is something we've got to do. And so do you want me, I can go into the probiotic thing, or do you have a question before I go there?
No, go
So
for
then I was
it.
like, okay, well, the answer is probiotics, right? Everyone knows you take probiotics, everything's fine. That's easy. That's maybe more acceptable than the fecal microbiota transplant to most people.
I have probiotics, prebiotics, and fiber is my
Okay, so
understanding.
yeah, thank you for bringing that up. So there's prebiotics, which is the actual organisms. Then you have um, uh, pro or syn, so prebiotics, probiotics, and symbiotics. So prebiotics is like fiber. So it's what the probiotics eat. Probiotics is actually the bacteria, the organism. It's alive. Symbiotics is a combination of prebiotics and probiotics. So kind of the thing with that is that if you send in a bacteria into the body, but you're not feeding that good bacteria. For example, say because our lawyers and doctors think. So lawyers eat pasta, doctors eat hamburgers. So if you only feed pasta, only the lawyers will live. So if you want, to have a balance, you need to have the pasta and the hamburger. Maybe a better thing would be carrots and spinach, two healthy things. But if, so
Yeah.
if you want to take that organism into your body, if you don't also take in the food that organism needs to leave, it's kind of a waste. So that's where there's a lot of new research done, not as much in America, but in Europe and in Australia and other countries. They're doing where they say symbiotics, which is the food to feed the bacteria, and the bacteria has huge effects. Well, they thought as restoring flora, but a lot of research I found is probiotics. Then you test is did it colonize? Did it actually start living in your body? And when you test as they're taking the probiotics, yes, it's live, it's coming out, it's there. When you stop taking the probiotic, it actually stops appearing, which means it's not necessarily having good colonization, which is like, oh, we always,
So if but if you take
Mhm.
fiber along with the
Which is a
probiotics,
prebiotic.
what happens then?
So they've found
Yeah,
there's
the
better
prebiotic.
effect at colonization if you include a prebiotic. But again, if you stop feeding what that bacteria needs to eat, then it's not going to live. So a probiotic is only as good, it'll go into your body, but if you don't change your lifestyle, because stress kills good bacteria, diet kills good bacteria, physical activity can all kill, lack of physical activity can kill good bacteria. So if you're not maintaining that kind of a lifestyle, then the probiotic only helps as long as you're actually taking it. It doesn't, in other words, it's not like you take it, you got a new colony, you're good. That's not how it works per se.
So
Go
if
ahead.
correct me if I'm wrong. So there's a few friends of mine who are really stressed out all the time, and maybe they're not getting good sleep.
Yeah.
Uh, they have whatever job or family related issues or whatever it is. If they take fiber, prebiotics, probiotics, or the
Hmm.
symbiotics, um, will they instantly, like feel better
Yeah.
and,
So
like next
thank
few
you for
days?
bringing that up. Yeah. So actually, what they've determined is what's interesting about probiotics, and this is very interesting in an intensive care setting, is that sometimes the benefit is not in colonization, but it actually has anti-inflammatory properties. So even if they don't make a colony within your digestive tract, taking the probiotics is anti-inflammatory. So the process of just while that good bacteria, the lactobacillus, is in your body, it's doing wonderful things as far as decreasing that permeability I talked about, decreasing systemic inflammation. So it's very beneficial. But in order to really get it to colonize, there's a lot more research that's really being worked on with symbiotics to determine, okay, and I'm talking to someone else right now about he's really trying to research which strain is the most beneficial to give that will actually colonize. Because certain strains will colonize better than other strains. So some of them might, but they're all anti-inflammatory.
So, so lactobacillus is not. the latest, the
It is.
best?
It's
There are some other
wonderful.
strains
No,
available.
so I'll have to reach out to him and ask which he's doing. He specifically is doing research with fecal microbiota transplants and which organism is the most beneficial to transplant that actually will stay. So now to jump, so you have your prebiotics, probiotics, symbiotics, then you have your transplant. When you give someone a transplant, it colonizes. So it's very different. So taking something orally, they do live. I think a lot of people wonder, does it live when it goes through the stomach acid? Yes. The probiotic can live through your digestive system and they make it all the way to your large intestine. But as far as effects of colonizing, that's where the fecal microbiota transplant is much more effective at actually going, yes, you now have a new colony, goodbye, done. Now you're going to have less inflammation long term.
Very interesting. Um, this is very interesting. So, what, um, what I have noticed that some days when I have um, like maybe I'm really stressed out, I have this really bad feeling in the stomach. You know what I mean? When you have dread, especially dread, you have this sinking
Mhm.
feeling in the stomach. I don't know if this is related to that, but
Oh,
yeah,
yeah, we can bring up
just
the connection because there's this exciting research that I've read the article probably, let's be honest, I probably read it 6 times. I get something new every time. But they're doing this study right now, rats, and they give them basic anxiety. They give them deep stress. And then they like do things like they deprive them of food, sleep, like horrible. It's really bad. But then they take
my
I know,
God.
then they take a sample of their microbiota and they transplant it into a rat that has no stress. And then they can test like as far as like will to live, desire for food, desire to be around others. Most animals want community. The perfectly happy, I had no stress, my life is perfect rat, and they give them the different microbiota, they actually will start exhibiting depression and anxiety simply from having a different microbiome, nothing else. So yeah. So then they're like, so,
Wow.
so I'm gonna get to your thing of your sinking feeling. So the thing I love about this is they actually tested the brain, the hippocampus in specific, which is your fear part of your brain. And they actually said, what's going on with these changes? And they actually found when you change what happens inside your gut, when you simply change the organisms living in your gut, it actually affects the chemicals released in your brain. And it's a direct connection, and it increases systemic inflammation. I mean, the tumor necrosis factor is something that comes when you have like something attacking your body. So you have actually increase in these inflammatory markers and inflammatory mediators in your brain simply from having a different organism living in your gut. So if you're saying you have a stress, is it your brain that's affecting your gut or your gut affecting? That's a good question, but there's no question that when you have fear and anxiety, it will absolutely affect what's going on. And it could even like start killing off the happy good bacteria, which release serotonin, which makes you happy. So it's kind of a catch-22 and it just gets worse and worse.
Maybe it works both ways.
Yeah.
But what I'm thinking now is, what about um, all these? A lot of people are going to meditation classes, yoga classes. They're
Yes.
going to the therapist. They're
Mhm.
going to they're going whatever. There's so many things that are there. Um, and what if you just get a transplant and you're good to go? Like, is that going to change things? Like, what do you think?
So I love that point because there's like as far as the brain gut connection. So the thing I would love to do is you have someone with say a trauma, so a car accident, they have horrible flora, give that person a transplant and then talk to them about meditation, then talk to them about diet. But it's kind of like you cut off someone's arm and then say, okay, now drive a car. You expect it to be easy. So you put
Yeah.
them into the hospital and you completely cripple their immune system, their mental state, their inflammation. And then you go, okay, now go live normal life, don't come back. So it would be nice if we could look, okay, is it prebiotics? Is there a better prebiotic? Is it fecal microbiota transplant? What can we do to first replace that, and then yes, meditate, eat good food, but let's start them like give them a running chance. So yeah, that,
Got it.
I wish there was a way to do that now.
No, now I understand why you've gone back into the medical field,
Yeah.
to promote this angle of things, especially in our healthcare system in North America. We definitely need it. Um, so tell me more about how your journey's been so far, in terms of having hospitals change their
Oh, that's a good,
approach.
and that goes back to where I started. So I'm excited, I'm passionate, I want to make these changes. I read the research, I'm like, this is solid research. It's amazing. Other countries are implementing it, and I was like, and then I read the hospital policy for a hospital, general, just a hospital, and it specifically says, do not give patients probiotics. It is against hospital policy. And
Okay,
so I was like,
that's surprising.
so I went to a, I'm me, so I went and met with someone in administration, and I asked them a question, and they sent me an article. And there's one article, there's more than one, there's a couple, but one of them that they were quoting had like 8 to 10 research subjects versus 8,000 in the one I'm talking about, and there was 10 immunocompromised people, two of them
Oh
died.
wow.
And it's like in an ICU setting, honestly, it's like 50-50 of who's gonna make it often. So two people out of 10 passed away, and this person had no microbiome, they had no immune system, they probably had advanced cancer. I think one of them did have advanced cancer. And there was a like, so they did this, in this case, it was probiotics. And then the probiotics caused an infection. And so it's like, okay, so no one should take probiotics because this one person passed away. And so this is then I loved the meeting with this doctor, and I appreciated the wisdom because I kind of thought, oh, this is works, it's going to be easy. Well, there do have to be exclusion criteria. Not everyone's a candidate, but you can't exclude the thousands that would benefit for the few that would not. And so I realized, and this is where I would love to find a system to do this. There has to be a way to let things that are effective make it through into care plans, make it through into treatment, with also taking the advice of very wise doctors who see that it does not apply to everyone. And so there has to be a way to balance this, to not block it from some people, but also protect those that it truly is not the right treatment choice for. So
I
well, that's
I
one thing
I
I want to figure out.
100% I 100% agree. And yeah, the future seems bright, is all I can say.
Yes.
So they are implementing it though in Europe and Australia, you mentioned. So there's no way of giving an example or
Yeah.
something like that.
So the one doctor I met with, he said that, all we need to do is find a certain types of research, and then bring it to him, and then he would present it to the team of doctors. So I was really excited at the receptivity to it, but it is implementing anything new is scary. When you have a life, and imagine if it's your child, and someone goes, this herb could save their life, but one person out of 10,000 died. Would you give that to your child?
Yeah.
So doctors care for their patients so beautifully that they have to always balance that. And I think there's a fear of implementing things because of the what if. But what I feel like when you go to, but I think that we do a better job than we realize. And this is where I'm hoping we can change practices, because you go in to get a procedure. What do? Well, this could kill you. You might be paralyzed. You may never see again. You may never have children, but do you want it? Like, and most of them are like, okay, yes, I have cancer, so yes, I want to remove it. But you hear this laundry list of things. So is there a way when we're implementing new practice, we can simply go, if there's a risk, which the risk may be greater for someone with an extremely compromised immune system, less for someone who maybe just had a car crash, do we present the facts and let the patient decide? Versus we screen everything as the practitioners and don't even let the patient see the options.
That makes sense to me. I mean, you have my vote if that's worth anything.
Let's change the world.
Yes. And before we close, I just wanted to share with our audience about where they can get in touch with you.
Oh, sure.
Uh, so this is her LinkedIn page. Make sure to connect with her on LinkedIn and send her a message or whatever. And this is where Lorena is there.
And I'm
Make
excited
sure to
to,
connect and
yeah, to connect
go ahead.
with people who are doing research. I think if we can kind of pool the minds
Yes.
together, I'm more of like the facilitator. I've not done active research, but I love to find it and share it. So what could we do as far as I'm talking to a microbiologist now? Let's pool together, let's find this research, let's present things, and then let's implement change.
Is that coming from your project management background?
I that would make sense, but I think it's just me. In truth, like I had a friend who had lupus that led to lymphatic cancer, and I just as soon as I find a research tool, I dig into the databases, and I love to read meta research. I love to read systematic reviews, and I love to like look and go, this is great research. This is more junky research. And then I'd love to find answers, see what's being done, and I get excited about it, and I love to share it with people. So I've done some of that in my work. I've done some literature reviews, but it's something that um, it's probably just a part of the background of my life.
No, that sounds amazing. So I'm glad that we had this chat, and I'm sure that people in our audience have gotten a ton of value. And there may be some researchers out there who will pretty much reach out to you, hopefully, and we will definitely make this a better place. If I could, this actually reminds me of this movie Limitless. I don't know if you've seen
Oh
it, where
yeah.
the person takes a pill
Hmm.
and his brain becomes like he becomes super smart all of a sudden. But this is kind of like you de-stress everything and suddenly become a more better functioning adult. So which is brilliant. I
Absolutely.
love it.
Thank you.
Okay. Anyways, Lorena, that was all we had time for. And yeah, looking forward to hearing more from you again.
Okay, sounds great. Have a great day.